Tell us about a challenging patient situation you've encountered and how you handled it.
In my experience as a nurse, one particularly challenging situation involved a patient who was admitted with severe respiratory distress and was highly anxious due to their condition. The patient, who had a history of chronic obstructive pulmonary disease, COPD, was struggling to breathe, which understandably heightened their sense of fear and panic. This anxiety was exacerbating their symptoms, making it difficult to stabilize them. As the primary nurse on duty, I recognized that managing both the physical and emotional aspects of the situation was critical. I immediately ensured that the patient was connected to supplemental oxygen and worked closely with the attending physician to administer prescribed medications, including bronchodilators, to ease their breathing. While addressing the clinical needs, I focused equally on building trust and calming the patient. I introduced myself clearly and reassured them that I was there to help. I explained every step of the treatment process in simple, understandable terms, which helped reduce their anxiety. To further ease the situation, I employed non-pharmacological interventions. I coached the patient through relaxation techniques, such as controlled breathing, to help them regain a sense of control over their breathing pattern. I also engaged their family members, who were present, to provide emotional support, making sure they were informed about the patient's condition and involved in the care process. Their familiar presence played a significant role in calming the patient. Throughout the ordeal, I maintained open communication with the interdisciplinary team to ensure timely adjustments to the treatment plan. After the patient was stabilized, I continued to monitor them closely, providing reassurance and education about managing their condition to prevent similar episodes in the future. This experience reinforced the importance of a holistic approach to patient care, where addressing emotional and psychological needs is as vital as meeting physical health requirements. It also emphasized the value of teamwork, clear communication, and the ability to remain composed under pressure.
How do you prioritize tasks in a fast-paced, high-pressure environment?
In a fast-paced, high-pressure environment, prioritizing tasks effectively is essential to ensure patient safety and maintain a smooth workflow. I rely on a systematic approach that combines clinical judgment, organizational skills, and flexibility. The first step I take is to assess the urgency and importance of each task. I quickly identify critical tasks that directly impact patient outcomes, such as responding to emergencies, administering time-sensitive medications, or addressing acute changes in a patient's condition. These tasks always take precedence. For example, if I have a scheduled dressing change but simultaneously notice a patient exhibiting signs of respiratory distress, I immediately address the urgent situation while communicating any necessary adjustments to the care plan. After addressing high-priority needs, I organize less urgent tasks based on deadlines and the overall needs of my patients. I use tools such as checklists or digital reminders to keep track of my responsibilities and ensure that nothing is overlooked. Effective communication with my team is another key strategy. I collaborate with colleagues to delegate tasks when appropriate, ensuring that patient care remains seamless even during peak periods. At the same time, I remain adaptable, as priorities can shift rapidly in healthcare. For example, if a new patient is admitted with critical needs, I reassess my current plan and make adjustments accordingly. Throughout the process, I stay calm and focused, which helps me make sound decisions under pressure. Additionally, I take steps to minimize inefficiencies, such as grouping similar tasks when possible, for instance, performing assessments for multiple patients during a single round. This helps me save time and ensure that I'm available for unforeseen situations. Ultimately, my ability to prioritize comes down to maintaining a patient-centered approach, ensuring that the most critical needs are met promptly while balancing the demands of the unit as a whole. This structured yet flexible mindset allows me to provide safe, high-quality care in even the most demanding environments.
Describe your experience with medication administration, including safety protocols and adverse reaction monitoring.
Medication administration has been a fundamental part of my nursing practice, and I approach it with meticulous attention to safety protocols and patient well-being. My experience spans administering medications across various routes, including oral, intravenous, intramuscular, subcutaneous, and topical, for diverse patient populations and conditions. To ensure safety, I adhere strictly to the 5 rights of medication administration: the right patient, right drug, right dose, right route, and right time. I confirm patient identity using 2 identifiers, such as their name and medical record number, to prevent errors. I also cross-check the medication order with the patient's chart, verifying it against their allergies, medical history, and current condition to ensure appropriateness. Before administering any medication, I take time to educate the patient about the drug's purpose, potential side effects, and any special instructions, ensuring they understand the importance of adherence. This not only fosters trust but also empowers patients to be active participants in their care. Monitoring for adverse reactions is another critical aspect of my role. For example, when administering antibiotics, I observe closely for signs of an allergic reaction, such as rash, swelling, or difficulty breathing, and take immediate action if necessary. With high-alert medications like anticoagulants or insulin, I perform double checks with a colleague to reduce the risk of dosage errors. I also monitor lab values closely to assess the drug's efficacy and detect any potential toxicities, such as monitoring INR levels for patients on warfarin. In one case, I administered a new medication to a patient with a complex medical history. Despite thorough screening, the patient developed mild hypotension shortly after administration. I acted quickly to stabilize them by following the protocol, notifying the physician, and documenting the event in detail. This experience reinforced the importance of continuous vigilance and prompt intervention. In addition to hands-on practice, I regularly update my knowledge of pharmacology and medication safety by participating in continuing education and reviewing institutional policies. By combining a methodical approach, effective communication, and ongoing learning, I ensure that medication administration is performed safely and effectively, prioritizing patient care at every step.
How do you maintain effective communication with patients and their families, especially during stressful times?
Maintaining effective communication with patients and their families during stressful times is a cornerstone of my nursing practice. I approach it with empathy, clarity, and active listening to ensure that they feel supported and well-informed, even in challenging circumstances. First, I strive to create a calm and trusting environment by introducing myself clearly and addressing patients and families by name. I make a conscious effort to acknowledge their emotions, whether it's fear, confusion, or frustration, and validate their feelings. For example, during a critical situation, I might say, "I can see this is a very overwhelming moment for you. Let me explain what we are doing and why it's important." Clarity is crucial, especially when discussing complex medical information. I break down medical terminology into simple, easy-to-understand language and use visual aids or written materials when needed. For instance, if explaining a treatment plan, I ensure the family understands each step and what outcomes to expect. I also encourage them to ask questions and share concerns, ensuring they feel heard and involved in the decision-making process. During stressful situations, it's essential to stay composed and maintain a reassuring tone. I prioritize transparency, being honest about the patient's condition while remaining compassionate and hopeful. If I don't have immediate answers, I reassure them that I will seek clarification from the medical team and follow up promptly. Active listening plays a significant role in fostering effective communication. By giving patients and families my full attention, maintaining eye contact, and nodding to show understanding, I convey that their concerns are important. This approach builds rapport and trust, which is critical during high-pressure moments. I also recognize the importance of cultural sensitivity and tailor my communication to respect diverse beliefs and values. If needed, I involve interpreters or cultural liaisons to ensure understanding and respect. An example of this was when I cared for a patient in the ICU whose family was distressed due to the uncertainty of the situation. By providing regular updates, explaining the care plan step by step, and being available to answer their questions, I helped alleviate their anxiety. They expressed gratitude for feeling included and informed, despite the stress of the situation. Ultimately, effective communication during stressful times is about showing empathy, building trust, and ensuring that patients and their families feel supported throughout their healthcare journey.
Explain your understanding of infection control and prevention measures.
Infection control and prevention are critical components of nursing practice, as they protect patients, healthcare workers, and the community from the spread of infections. My understanding is rooted in evidence-based practices and strict adherence to established guidelines, such as those from the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC. A fundamental principle of infection control is maintaining proper hand hygiene. I consistently practice the 5 moments for hand hygiene, ensuring I clean my hands before and after patient contact, after exposure to bodily fluids, before aseptic procedures, and after touching patient surroundings. Using alcohol-based hand sanitizers or soap and water, depending on the situation, is a non-negotiable standard. I also follow the use of personal protective equipment, PPE, tailored to the type of care provided and the patient's condition. For example, I wear gloves, gowns, masks, or eye protection as required to prevent exposure to pathogens. During the COVID-19 pandemic, for instance, I strictly adhered to enhanced precautions, including the proper donning and doffing of PPE, to minimize risk. Environmental cleanliness is another key aspect. I ensure that patient areas and medical equipment are regularly cleaned and disinfected according to protocol, reducing the risk of cross-contamination. When caring for patients with infectious diseases, I follow isolation procedures, such as contact, droplet, or airborne precautions, to contain the spread of pathogens. I also educate patients and families about these precautions to promote compliance and understanding. Invasive procedures, like catheter insertions or wound care, require aseptic techniques to prevent infections. I ensure sterile equipment is used and that I maintain a contamination-free environment throughout the procedure. Additionally, I am vigilant in monitoring patients for signs of infection, such as fever, redness, or swelling, and promptly report these findings to initiate early intervention. I also play an active role in promoting preventive measures like vaccination, proper nutrition, and infection awareness education. Continuing education is a priority for me to stay updated on infection prevention strategies and emerging threats, such as multi-drug-resistant organisms. By maintaining a proactive and comprehensive approach to infection control, I contribute to a safer healthcare environment and improved patient outcomes.
What is your experience with wound care and dressing changes?
My experience with wound care and dressing changes spans a variety of clinical settings and patient populations, including acute care, postoperative recovery, and chronic wound management. I have developed strong skills in assessing wounds, applying evidence-based dressing techniques, and collaborating with interdisciplinary teams to ensure optimal healing. When performing wound care, I begin with a thorough assessment of the wound, evaluating its size, depth, color, and the presence of any exudate or signs of infection, such as redness, swelling, or an odor. This allows me to document changes over time and adjust the care plan as needed. For instance, I've cared for patients with pressure ulcers, diabetic foot ulcers, surgical wounds, and burns, tailoring my approach to each specific type of wound. I adhere to strict aseptic technique to minimize the risk of infection. Before beginning the procedure, I prepare all necessary supplies and ensure the environment is as sterile as possible. Depending on the wound type, I use appropriate dressings, such as hydrocolloids, foam, alginates, or antimicrobial products, to promote moisture balance, reduce bacterial load, and encourage healing. For chronic wounds, I have experience using advanced therapies, such as negative pressure wound therapy, NPWT, which has proven effective in improving outcomes. Pain management is an integral part of wound care, and I ensure patients are comfortable before and during the procedure by administering prescribed analgesics or using non-pharmacological techniques, such as distraction or relaxation methods. I also emphasize patient education, teaching them and their caregivers about proper wound care at home, recognizing signs of infection, and maintaining a balanced diet to support healing. For example, I've educated diabetic patients on maintaining blood glucose control to enhance wound recovery. Collaboration with the interdisciplinary team is essential. I regularly consult with wound care specialists, dietitians, and physical therapists to create a comprehensive plan tailored to the patient's needs. I also participate in wound rounds to share insights and learn from best practices. One notable experience involved managing a complex postoperative wound with delayed healing. By coordinating with a wound care specialist and consistently monitoring the wound's progress, I was able to implement advanced dressings and ensure the patient received proper nutrition and infection control measures. The patient showed significant improvement, which was both rewarding and a testament to the importance of a holistic, evidence-based approach. My experience has taught me that wound care is more than just a clinical skill, it's an opportunity to support patients through a challenging aspect of their recovery, ensuring their comfort and confidence in the healing process.
How do you stay updated with the latest evidence-based practices in nursing?
Staying updated with the latest evidence-based practices is essential to delivering high-quality patient care, and I prioritize continuous learning and professional development in my nursing practice. My approach combines formal education, professional engagement, and independent research. I regularly participate in continuing education programs, workshops, and seminars focused on advancements in healthcare. These opportunities allow me to deepen my understanding of emerging best practices, new technologies, and evolving guidelines. For example, I have attended training sessions on advanced wound care, infection control updates, and medication safety practices to enhance my clinical skills. Staying connected to professional organizations, such as nursing associations or specialty groups, is another way I stay informed. These organizations provide access to journals, webinars, and newsletters that highlight the latest research and clinical recommendations. Subscribing to peer-reviewed journals, such as the Journal of Clinical Nursing or The Lancet, enables me to review cutting-edge studies and integrate findings into my practice. In my daily work, I consult trusted online resources like the World Health Organization, WHO, the Centers for Disease Control and Prevention, CDC, and my institution's evidence-based practice guidelines to ensure my care aligns with the most current standards. For instance, during the COVID-19 pandemic, I regularly reviewed updates on PPE protocols and vaccination strategies to adapt my practice accordingly. Engaging in interdisciplinary collaboration is another valuable method. Discussing case studies, attending grand rounds, or participating in quality improvement projects with colleagues helps me learn from shared experiences and gain insights into applying evidence-based approaches effectively in diverse clinical scenarios. Additionally, I reflect on my practice by reviewing patient outcomes and seeking feedback from peers and mentors. This reflection encourages me to identify areas for improvement and pursue targeted education. Lastly, I embrace technology by utilizing digital platforms and apps designed for healthcare professionals. Tools like UpToDate or clinical decision-making apps allow me to access verified information and clinical guidelines at the point of care, ensuring my decisions are backed by the latest evidence. By integrating these strategies into my professional routine, I stay current with evidence-based practices, which not only improves my clinical competence but also ensures that I am providing the safest and most effective care for my patients.
Describe a time when you had to adapt to a change in patient condition or a sudden emergency.
During my nursing career, I have encountered several situations where adaptability and quick decision-making were essential. One notable experience involved a patient in the medical surgical unit who was recovering from abdominal surgery. Initially, the patient appeared stable, but during my routine assessment, I noticed a sudden drop in blood pressure, increased heart rate, and the patient complaining of abdominal pain and dizziness. These changes indicated a potential post-operative complication. Recognizing the seriousness of the situation, I quickly escalated the issue by notifying the attending physician and simultaneously began interventions to stabilize the patient. I ensured the patient was lying flat to improve circulation and maintained a calm demeanor to keep them as comfortable as possible while explaining what was happening. My primary focus was to act promptly while providing reassurance. While awaiting the doctor's arrival, I monitored the patient's vital signs closely, started supplemental oxygen as per protocol, and prepared for potential interventions, such as drawing blood samples or setting up for fluids. I also informed the charge nurse and coordinated with the team to ensure that the necessary resources were readily available. The physician arrived and suspected internal bleeding, requiring the patient to be transferred to the ICU for closer monitoring and further intervention. I worked with the team to facilitate a smooth and swift transfer, ensuring all critical information, including the patient's recent symptoms, medications, and vital signs, was communicated clearly during the handover. This situation highlighted the importance of staying vigilant, recognizing early warning signs, and collaborating effectively under pressure. By remaining calm and following established protocols, I was able to contribute to the patient's timely care, ultimately leading to a positive outcome. This experience reinforced my ability to adapt to rapidly changing patient conditions and underscored the value of clear communication, teamwork, and clinical knowledge in handling emergencies effectively.
How do you balance the physical and emotional demands of nursing?
Balancing the physical and emotional demands of nursing requires a combination of self-awareness, time management, and proactive self-care. Over the years, I've developed strategies that help me maintain resilience and provide high-quality care to my patients while safeguarding my well-being. Physically, nursing can be demanding with long shifts, extended periods of standing, and the need to assist patients with mobility or other tasks. To manage this, I prioritize proper ergonomics, such as using correct body mechanics when lifting or repositioning patients, and I make use of available assistive devices to reduce strain. I also stay physically active outside of work by maintaining a regular exercise routine, which not only improves my strength and endurance but also helps me manage stress. Emotionally, nursing requires deep empathy and connection, often in situations that are challenging or heartbreaking. I approach these demands by fostering a sense of professional detachment while remaining compassionate. This means being fully present for my patients but also recognizing the boundaries of what I can control. For example, when dealing with end-of-life care, I focus on providing comfort and dignity to the patient and their family while seeking support from my team if needed to process my emotions. Open communication with colleagues plays a significant role in maintaining emotional balance. Sharing experiences and seeking advice or simply debriefing after a particularly tough day helps me feel supported and prevents emotional burnout. Additionally, I practice mindfulness techniques such as deep breathing or short meditative breaks during my shifts to stay centered and reduce stress. Outside of work, I engage in activities that recharge me emotionally, such as spending time with loved ones, pursuing hobbies, or simply enjoying quiet moments to reflect. I also make it a point to recognize and celebrate the positive impact of my work, whether it's a patient's recovery or a family's gratitude, which keeps me motivated and grounded. Lastly, I'm mindful of recognizing when I need additional support, whether through peer discussions, mentorship, or professional counseling, to process particularly challenging situations. By acknowledging my own needs and addressing them proactively, I can sustain my ability to care for others. Balancing the demands of nursing is an ongoing process, but by prioritizing self-care, building a strong support network, and maintaining a sense of purpose, I am able to navigate the challenges and continue to provide empathetic, effective care to my patients.
What are your long-term career goals within the field of nursing?
My long-term career goals within the field of nursing are centered on advancing my clinical expertise, contributing to the improvement of healthcare systems, and making a meaningful impact on patient care and the profession as a whole. In the immediate future, I aim to deepen my specialization in a specific area of nursing, such as critical care, oncology, or pediatrics, depending on where my skills and passions align most strongly. Achieving this goal involves pursuing additional certifications and advanced training, such as obtaining a critical care registered nurse, CCRN, certification or a similar credential relevant to my chosen specialty. Over the next several years, I aspire to further my education by pursuing an advanced degree, such as a Master of Science in Nursing, MSN, or becoming a nurse practitioner, NP. This would allow me to take on a more autonomous role in patient care, expand my clinical decision-making responsibilities, and potentially focus on a subspecialty that interests me deeply, such as family medicine or gerontology. Beyond direct patient care, I am passionate about education and mentorship. One of my long-term goals is to contribute to the professional development of other nurses, whether by serving as a clinical educator, preceptor, or nursing instructor. Sharing knowledge and supporting the growth of future generations of nurses is a way for me to give back to the profession. I also envision taking on leadership roles within healthcare. As I gain experience and a deeper understanding of healthcare systems, I aim to contribute to policymaking and quality improvement initiatives that enhance patient outcomes and operational efficiency. This might involve working as a nurse manager, participating in hospital committees, or contributing to research projects that inform evidence-based practices. Ultimately, my overarching goal is to make a lasting difference in the lives of my patients, colleagues, and the communities I serve. Whether through clinical excellence, education, or leadership, I am committed to continuously evolving as a nursing professional and contributing to the advancement of the field.